Local public health in America is central to our delivery of public health. You can't have public health without local public health. Everybody lives locally. It doesn't mean that you can't have strong national leadership. It doesn't mean you can't have strong state-based systems. By our Constitution, you must do that. But basically, public health can only be delivered at the local level. It's not just Hugh Tilson saying so. It's not just past president of NACCHO in 1978 saying so. The Institute of Medicine opined on that in 1988 in its seminal report on the future of public health, when it said, since I wrote the sentence, I know it pretty well, public health can only be delivered by a local component of the government public health system. That means local health departments, a governmental presence at the local level was the turn of phrase we used. That's us. And we can't be effective without coordination, education, communication, and advocacy. And that's hard to do at the local level alone. You have to do that with partners, and the way to get partners is to have an association. It has to be effective, it has to be credible, it has to be current, it has to be powerful, and it has to be national, and that's NACCHO. So can you imagine the future of public health without a strong national organization to advocate and advance it? I can't. And that strong national organization has to be NACCHO. So how will NACCHO evolve in the next 30 years? Well, first of all, it will build on a strong, effective platform of the last 30 years, and good for us for that, and good for the country that we are able to do it. But what do we need to do more? Well, what we need to do is to have our partners at the national level, our public health delivery partners, the National Indian Health Board and ASTHO, advocate for us to be at the table with them as peers, advocating for the public health delivery system and its excellence and accountability. And then we need to have the national organizations responsible at the federal level for financing, delivery, and accountability, and providing technical support. That would be CDC and HRSA and national organizations that you all can spell with alphabet soup as well as I can, insisting that we be full, equal, respected partners at the table as policy is developed and programs are rolled out. So a powerful platform is the future for NACCHO. Now, that doesn't mean that NACCHO doesn't also have to develop a stronger technical assistance component. For us to be effective at the local level, we need people at the national level who are current, connected, and can keep us coordinated. And that's a strong national organization as well, and accountable. At the national level, we need to have public health standards which evolve as public health evolves, and then can be applied at the local level. So strong partnership with a national level accreditation activity. I see the future of NACCHO inextricably intertwined with the future of the Public Health Accreditation Board, FAB, and every health department at the local level. Oh yes, and having local health departments in every community, no matter how small or remote. Those are Institute of Medicine words as well. Nobody should be without a local health department. NACCHO needs to advocate for it. FAB is working to build platforms for continuous process improvement to build the capacity of those agencies, and all together, we have a glorious future if we play it right. So I'm still Hugh Tilson, and I was Hugh Tilson when I got elected to the executive committee of NACCHO in 1976, and then to presidency of NACCHO in 1977, 78. Oh, and I still have the gavel to prove it. When I retired as president, I got this. That didn't say thank you. It just said that that's what I did. But I keep it on my desk to remind me of that extraordinary time. So think back to the 70s, those of you who were alive then, and consider them for those who weren't. I am wearing my 1970s costume. This is what I wore to the office every day. Remember coats and ties? Remember rep ties? Well, those were creatures of the 70s. I did not wear my bell-bottoms to the office, but I could have, except that, of course, I would have been laughed out of the county courthouse had I done so. So what happened in 1976? Well, that was the year of swine flu. And so it was a seminal year for public health at the local level because we were thrust into the national limelight as the ostensive delivery system for swine flu vaccine nationwide. You couldn't get into the arms of local people without a local delivery system. And we were it, and recognized by it by then Director of the Centers for Disease Control, Dr. David Sencer, a great advocate for local public health and a great supporter of what we were trying to do. That's the good news. The bad news is we were inconsistent, inadequate on the ground. So we didn't have a robust local public health infrastructure. Ours in Multnomah County was pretty darn good, and we got vaccine into the arms of the people in Multnomah County, but we couldn't do that nationwide as a national public health infrastructure at the local level. And then along came Guillain-Barré syndrome, which interrupted the program anyway. There were outbreaks of Guillain-Barré syndrome, and we didn't have a robust public health information and epidemiology infrastructure to be able to differentiate Guillain-Barré syndrome caused by vaccine, disease, or just unexpected clusters as part of the natural history of life, because we didn't have the infrastructure. And so we had to default to the conservative position, which was it could have been the vaccine, and so the vaccine program ended abruptly and gave public health at the local level and national level a black eye. Because of that, David Sencer convened a group of us at the Centers for Disease Control to see what went wrong and try to do something about it. And out of that was spawned the Model Standards for Community Preventive Health Services, a 2-year effort that was co-sponsored by and co-staffed by Conference of City Health Officers, Association of County Health Officers, and the Association of State Health Officers. So USCCLHO, NACCHO, and ASTHO were all at the CDC table and very prominent in the development of a national program to say what should happen in every community, no matter how small or remote,